Faculty development that supports the implementation of competency-based residency education needs to consider the current and new roles for those involved. This includes a long list of people: residents, physicians and other team members who teach and assess, the many education leaders at the hospital sites, program directors and administrators, competence committees and their chairs. Let's look at the 5 key differences in competency-based education processes that we need to consider in faculty development. First, we're using a more explicit developmental approach to residency education with distinct stages. Number 2, now we view time as a resource rather than the key organizing framework for success. Number 3, the performance of residents is more specifically assessed on a detailed assessment plan that includes more workplace-based assessments, including entrustable professional activities, also known as EPAs. Number 4, trust is explicitly communicated and documented based on observed performance. Number 5, enhanced feedback and coaching is used to guide improvements in performance. There are 6 ideas that guide the faculty development planning, design, development, implementation, and delivery. First, we need to be cautious when we're implementing competency-based programs and faculty development to not harm patients, care teams, programs, or systems. Number 2, each and every competency-based conversation is faculty development. Number 3, we need to consider what is the smallest amount of faculty development necessary to support the individual, program, or system success. Number 4, we need to build on what works, reuse ideas and resources. Number 5, we need to keep in mind that one size doesn't fit all. We need some adaptation and customization for individuals, programs, and systems. Number 6, we need to be prepared for faculty development to be ongoing and for it to be done in many, many ways.
So faculty development is so important for competence by design because as we make this huge shift in how we train our residents nationally, we're asking our faculty to do something different than they've done before, and in a way added work to what they've done before. So it's really important that we prepare them and provide them with the tools to be able to do this work properly and well and to their own satisfaction. So for example, some of the things that we have found have worked really well is engaging faculty in their own environment in small boluses, providing them with just-in-time information, providing an overview of competence by design, and then letting them know how an interaction might go with a resident in this new system around the observation, the coaching, and the feedback pieces. What faculty seem to like is the acknowledgement that they're the ones doing the work, that we will come to them, bring them the information, answer their questions, listen to their concerns, and also take their feedback and incorporate it into the overall plan.
Let's look at the topics for faculty development. 3 hot topics that we've noticed people are very interested in are assessment tools, how the online interface functions, and what CBD means to them in day-to-day clinical practice. 4 very important topics are competency-based education as change management, how to improve the giving and receiving of feedback, how to decide, document, and share information about entrustment, and how to complete learner handover, including appropriate disclosure of learner needs. What is included in faculty development? In a word, everything. Faculty development is all forms of communication, including emails, newsletters, and websites with sample tools, handouts, slides, and training video. Faculty development includes conducting workshops and coaching people on the phone or at business meetings. Development of faculty and learners for competency-based implementation is a partnership between the Postgrad Office, the Center for Faculty Development, the departments, and programs. Each program and department is encouraged to have a targeted, strategic, and staged approach that occurs in the 6 to 9 months before launch.
One of the things we felt really worked in terms of getting our residents and faculty ready for competence by design was checking in early after launch. We had an excellent resident and faculty development plan, but by checking in early, our residents and faculty were able to tell us the challenges they were having, and we were able to respond with information and resources so they didn't become frustrated as we moved forward.
Regular meetings of key education leaders and residents in the ramp up to implementation is key to building confidence and competence.